Agoraphobia is an anxiety disorder in which the individual experiencing it has a fear of public places or open spaces when escape is not possible or difficult, or help unavailable should they become embarrassed, incapacitated, or experience a panic attack. Some examples of places that the individual fears are buses, planes, marketplaces, bridges, shops, and standing in line. The term agoraphobia literally translates as a fear of the marketplace. Agora is the Greek word for marketplace, and phobos is the Greek word for fear, coming from the Greek god of the same title. The DSM-5 outlines the diagnostic criteria for agoraphobia, which an individual must fulfill in order to be properly diagnosed with agoraphobia. First off, the individual must display a marked fear or anxiety about two or more of the following 5 situations, which include using public transportation, being in open spaces, being in enclosed spaces, standing in line or being in a crowd, or being outside of the home alone. The individual must also fear or avoid these situations because of thoughts that escape might be difficult or help might not be available in the event of developing panic-like symptoms or other incapacitating or embarrassing symptoms as stated in the definition. These agoraphobic situations must also almost always provoke fear or anxiety. In addition, the agoraphobic situations must be actively avoided, require the presence of a companion, or be endured with intense fear or anxiety. The fear, anxiety, or avoidance must also be out of proportion to the actual danger posed by the agoraphobic situations and to the socio-cultural context. It must be persistent, typically lasting 6 months or more, must cause clinically significant distress or impairment in social, occupational, or other important areas of functioning, and cannot be better explained by the symptoms of another mental disorder. Every year, approximately 1.7% of the population experience agoraphobia. Of this number, women and the poor are twice as likely to experience it than others. The average age of onset for agoraphobia is about 20 years old, but it is usually diagnosed between the ages of 18 and 35. Some of these treatment options include exposure therapy, support groups, antidepressants, home-based self-help groups, cognitive behavioral therapy, and even hypnosis. Agoraphobia is a disorder that is very hard to treat because its causes are often centered on complicated and abnormal family dynamics, which result in treatment options that are usually long-term. Because of this, it is important to use information about agoraphobia, such as its diagnostic criteria, prevalence rates, and treatment options, to gain a better understanding and spread the awareness of agoraphobia.